We're living a nightmare. It is real, it is frightening, and it is absolutely affecting our community.
Starr County, Texas had less than 10 confirmed cases of COVID-19 when the governor ordered the state reopen in May. Now they've had more than 1,200.
Prior to the reopening, we were at 7 positive cases, 0 fatalities, 0 hospitalizations. Fast forward to today, and the numbers are simply astounding, and there's no end in sight.
Last week, Texas reported 5 consecutive days of more than 10,000 positive cases and saw 4 of its deadliest days since the outbreak began. Numbers that are especially scary in communities like this one.
You're looking at uninsured, underinsured, high prevalence of diabetes, hypertension, obesity, and all these risk factors impact our community.
The small community on the U.S.-Mexico border is almost entirely Hispanic, a group that is dying from COVID-19 at a higher rate than white Americans. The lone hospital within a 50-mile radius serves roughly 65,000 people. It has 48 beds and no intensive care unit.
Right now we are at full capacity in our COVID area. I don't think at this point is getting better. I think the numbers are consistently going up.
As hospitals across the state reach capacity, small rural facilities like this one are being pushed to the brink. Dr. Jose Vasquez is the county health authority.
We are not prepared to be managing ICU patients. However, it's been impossible to transfer those patients.
Vasquez says the hospital needs more staff and oxygen tanks that would allow them to send some patients home. Without those resources, he fears what could come next.
The worst case scenario for me, it will be the time where all our beds are full, where we don't have any more ventilators to offer, and to see patients dying in the corridors or in the emergency room without the possibility of doing something for them.
And how close do you feel like things are to that here? Is there still time?
I don't think that we have too much time.
As hospitals here are working to treat COVID-19 patients, Texas Governor Greg Abbott has deployed federal resources to the area, including a medical task force team to help those inundated hospitals and a mass testing site, one of only 3 in the country, to help track and contain the spread of the virus. I traveled about 50 miles east of Starr County to Edinburgh, Texas, to speak with that site administrator. The location is now closed, and it's up to the county to continue that testing.
You know, there's over 1.5 million people here in the Rio Grande Valley, not to mention the fact that we also are bordering another country, so continued testing is paramount.
The U.S. has a per capita rate of infection about 4 times that of Mexico.
The border doesn't have a border for disease. It's our culture, it's our business to have people from the United States go to Mexico, work, travel, leisure time, and then return, and vice versa.
One of many concerns in a close-knit community where strong family ties can make it hard to stop the spread.
Many of our households here in Hidalgo County are made up of 3 generations of people living in the same household. So we have grandparents, parents, and grandkids with clusters of people being infected.
Hidalgo County now bringing in refrigerated trailers and funeral directors to help as the death toll continues to rise. Back in Starr County, the mayor of Rio Grande City just wants what's best for his town.
Do you think Governor Abbott was thinking of communities like yours whenever he ordered the state reopen?
No, I don't believe that he did. However, we have the opportunity right now today to correct this.
A correction that many in the Rio Grande Valley say can't come soon enough.
The White House is meeting with Senate Republicans today trying to hammer out details for a second coronavirus stimulus plan. MSNBC correspondent Garrett Haake joins me now from Capitol Hill. Garrett, tell us, what do Senate Republicans want to see in this next stimulus bill?
Well, Savannah, there's a whole laundry list of things that Republicans have laid out that they want to see included in this bill. Everything from protecting companies with liability protection so they don't get sued when they reopen, to finding ways to fund things like testing and tracing and sort of covering all their economic bases along the way. On the floor of the Senate this morning, Mitch McConnell laid out a couple of new items that'll be going into this bill. Take a listen.
This majority is preparing legislation that will send $105 billion so that educators have the resources they need to safely reopen. We'll also be proposing a targeted second round of the PPP with a special eye toward hard-hit businesses. We want another round of direct payments to help American families keep driving our national comeback.
And Savannah, one of the other pieces of this that is still a moving target is what happens with those plussed up unemployment benefits. Remember, folks on unemployment were getting an extra $600 a week from the federal government. That's expected to run out on July 31st. I'm hearing discussions today that while Republicans don't want to keep that at the same level because they feel like it's an incentive for people not to go back to work, they are open to continuing some kind of additional unemployment assistance. We're just going to have to find that Goldilocks number of what that is.
Well, at least a little bit of relief for some people. Now, tell me, House Speaker Nancy Pelosi weighed in today. What did she say?
Well, she's mostly been talking about the timing of this. Remember, the House passed the HEROES Act, which they consider their opening offer in this back in May. So the House is essentially waiting to see the Senate act. But Pelosi said she thinks this is the kind of thing that could potentially get done by the end of this month, which would coincide with those unemployment benefits running out, an important early deadline.
And now, Garrett, let's talk about the timeline here, talk about that deadline. Is this getting done before the August recess?
Tough to see. There's a number of rolling deadlines here, everything from that unemployment insurance running out on July 31st to PPP funding running out on August 8th. They're supposed to begin their August recess. The Senate and House are the second week in August. Mitch McConnell has been more bullish. He doesn't know that this can get done by the end of next week. But I think early August is a reasonable time frame. They know what they're getting themselves into. There's a lot of negotiating that needs to be done. But lawmakers want to have that time both for the little bit of August vacation they get and to start their re-election campaign. So there'll be, I think, a lot of pressure on folks to get this bill done and get folks back to their districts and states.
All right. Well, we'll have to see. Thanks so much, Garrett. Kemp is suing Atlanta's mayor to stop the city from enforcing a mask mandate and other coronavirus orders he says are too restrictive. NBC News correspondent Blaine Alexander joins me now from Atlanta. Blaine, let's just start off right with why did the judge recuse herself? What do we know so far? Excuse me.
Well, Savannah, it's kind of a strange twist. It's not just one judge now, but two judges that have now recused themselves from this case. We just found that out within the past few minutes or so. So the first judge this morning, the recusal came down really just as those arguments were getting ready to start, just within about an hour and a half or so before those arguments were getting ready to start. That was done because the judge didn't want to have any illusions or anything that looked improper with that case. But the second judge, we found out, recused themselves as well because they were the inspector general under Governor Brian Kemp when he served as Secretary of State here in Georgia. So now the case is on its third judge, but it all comes back to this back and forth that we're seeing here in Georgia between the Republican governor of the state and the Democratic mayor of Atlanta over whether or not people should be required to wear masks in Atlanta. The mayor says yes. She says that science and data drive her decisions, and she says because the numbers are going up, they're going in the wrong direction, and because health experts have said that masks can help slow the spread of COVID-19, she's going to require that. But the governor, he says that while he does believe that masks are necessary, he encourages people to wear them. He says that he believes a mandate goes a step too far. The other thing that he said about this is that he's also trying to block the city from enforcing any sort of orders that are more or less restrictive than what he's put in place because he says that he wants uniformity across the state with policies. Savannah.
All right. So, Blaine, what happens next here in this case? Where does it go from here, especially now that we know that these two judges have recused themselves?
So what we were going to hear today was a hearing on an emergency injunction. This was essentially the governor's office filing to block the mayor from enforcing that mask mandate while the actual lawsuit snaked its way through court. So we're waiting to see where that lawsuit goes. Now, the state has actually, like we said, it's on the third judge now in this. And so we're expecting that it could come back in a courtroom anytime soon.
Thanks for the update on that, Blaine. And now while I've got you, I've got to ask about coronavirus cases in Georgia, where you are right now. The state recording 24,000 new infections on Monday. What are health officials saying about that?
Sure, and 2,400 new cases, more than 2,400 new cases yesterday in a single day. And the numbers are high. You know, health officials have said that, look, they're going the wrong direction. If you look at the 7-day moving average here in Georgia at the beginning of July versus what we saw back in April, that number has increased significantly. So, yes, those numbers are going in the wrong direction. You know, Governor Kemp has said that he's put measures into place. He said certainly he hasn't mandated masks. He says that he's not for that, but he's done other things like capping groups of people gathering at 50 in public places, mandating social distancing, urging people to wash their hands, to wear masks, to do things like that. He says that he believes that that will turn the numbers around and get them back toward what we saw earlier this year. But again, we're seeing, local leaders around the state of Georgia who say they have to go a step further. So that's why you're seeing not just Atlanta, but other local leaders also mandating masks as well. Savannah.
Thank you so much, Blaine. Also, girl, I got to say, you don't miss a beat even while you're battling those gnats or mosquitoes or whatever it is out there you're having to swat away. So thanks for sticking it out for us out there.
Georgia heat and the gnats come out when it gets hot. Absolutely.
Yeah.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.